GI practices out there who are like affected by COVID-19, and they are looking to digitalize during these times. I wanted to know if you have any advice to be given to these practices.
I know, Gitanjali, you just started a bot. I thought that was something very unique, to bring all the patients who are not scheduled right now or in the backlog to be able to schedule automatically. If you want to share about your experience, I'll add on from Sana perspective.
That would be great. So we have as you said, we've had patients that we had to put on the back burner in May and then in June, and then now we're suddenly bringing all of these patients back, because initially in Massachusetts we were only able to do diagnostic colons and high-risk colonoscopies, and now we're bringing people back. So to be able to use the RX platform or the bot to engage these patients, our staff can basically reach out to those patients because we have them in our EMR, and then the patients can weigh in as to what their preferences are. If we want them to come in for a procedure, they can talk about, we can get a lot of information from the patients, get them engaged, and then our staff is much more efficient when they reach them to schedule the procedure. So it's a nice net that's being sent out where you can capture patients and then get them booked in. So I'm very excited to be able to use that.
Thank you. This is wonderful. We use the initial version of the bot here at Sinai and reached out to around 1,100 patients in one go, instead of us physicians calling the patients and then saying, hey, do you want to come now? You feel comfortable, or later on. And we got within a day, 290 patients respond back with the schedule. So that's like $350,000 worth of revenue we were able to actually capture in a mostly automated manner through the bot. I don't know if you do have a demo of the bot. I think this is so unique that I think people may like to see it. And one of the things we are working with practices is it can be on the website, but this can also be prescribed to the patients on their phone directly through the platform. And once it is prescribed, it can remain with the platform forever, which means they can use it to schedule office visits, video visits, or endoscopy 24/7 without being on a phone call or dropping the phone calls on the way. So it's a very good, unique asset if you want to kind of show it as well.
Yeah, so this actually works the way I was just talking about. So I'm just putting in the name, date of birth, and specific details around, let's say, the insurance information, the preferences which the patient may have in terms of when they want to schedule their type of procedure and the date and maybe some time slots. So all of that information flows back to your schedulers, and they can automatically get them scheduled, or maybe just from perspective of reducing call volumes, you have all the pre-populated information, and if there are any questions, you can just interact with the patient and get it scheduled as a first step of digital engagement.
And this is great.
Yep.
And I think the best part is it gives the power to the patients because some patients are hesitant in scheduling in these times, and some people are very willing. And also, I think we are thinking how to use it for our IBD center as well. So it's not only for endoscopy, it can actually make office visits and video visits as well. One of the challenges we have seen is there's such a big hybrid nature. Some people want video visits, some want to stick to office visit, and giving a preference to the patients upfront really makes the job very easy for the schedulers downstream.